Hi everyone, I'm Dr. Lucky Seacon. I'm a New York City-based REI OBGYN, and I'm so excited to have the opportunity to have a conversation today with Rep. Sarah Jacobs. She's joining me shortly, and I know it sounds like this is political, this conversation I'm about to have. In reality, the topic we're going to be discussing, I think, extends far beyond politics. It's not political. I think this is a universal issue. Anyone who follows me understands how important it is. Any opportunity I can get to try to expand access to care. And something I care deeply about and think is a matter of fairness is that military families should have adequate access to care to build their families. And across the board, whether you're in the military or you're just talking, a civilian in general, I think that we really need to start flipping the script on how people regard fertility care. This is not elective. This is not a luxury. This should be regarded the same way we talk about pregnancy care. Doesn't matter who you work for, where you live. If you're pregnant, you deserve health care, and the same should be true of people dealing with infertility. So I am going to invite her in. Teach us about a bill that has been introduced that could, if it passes, expand care for military families when it comes to fertility treatments. Hi, how are you?
Good. How are you? Thanks for having me.
It's really great to meet you and to be having this conversation. I'm a huge fan of yours,
Oh,
by the way.
well, thank you. Well, likewise, I'm kind of fangirling right now.
Well, we're mutually fangirling because I love your social media presence. I love how unspoken you are. You're unapologetic. And when it comes to the things that matter, which is advocating for other people and making sure that there's parity and fairness, which we're going to be talking about, one of the motivating factors behind this bill. I feel like you're there front and center and you're doing the hard work day in, day out. So thank you. It's so nice to meet you. You're on the West Coast, right?
I'm in DC right now, actually, but yes, I
Oh, you are.
represent San Diego.
Awesome. So I would love for you to just tell us a little bit about who you are and how you got involved in sort of my arena, talking about access to IVF care, and then specifically focusing on military families.
Yeah, absolutely. So I'm Congresswoman Sarah Jacobs. I represent San Diego, which is the largest military community in the country. And I first got sworn into Congress when I was 31 years old. And when I got elected to Congress, I realized that I knew I wanted to have a family, but that this wasn't going to be a good time as I was trying to figure out this very busy new job. And so in my first year in Congress, I froze my eggs very publicly and had to explain to a lot of my colleagues what that was and what that meant. But I started hearing from all of these military families and service members that I represent saying that they wished they could do that, that they were going to go on deployment or they were being asked to do these really dangerous things during their prime reproductive years, and they wished they'd had the option to freeze their eggs. And, I paid for mine out of pocket. I truthfully think everyone should have access to this. I think
Yeah.
it's a really important way of having agency over your own life. And so I decided to introduce the IVF for Military Families Act. And what it would do is it would say that TRICARE, which is the military health insurance, would have to cover IVF treatment. It would have to cover 3 rounds of egg retrieval and then as many embryo implantations as needed. And we were very close to actually getting this done last year in a bipartisan way. It passed through the House Armed Services Committee in a bipartisan way, and then ended up getting taken out by Speaker Mike Johnson and getting all into the sort of culture wars around this issue. But we're trying again this year, in large part because actually starting this year, the DC Health coverage mandates that IVF is covered. And so members of Congress, we have to use the DC Health Exchange to get our health care.
Okay.
So members of Congress are about to get IVF coverage. And to me, it makes absolutely no sense that members of Congress are getting this coverage when our service members are not. So we're trying again this year, and I'm hoping we'll be able to get it across the finish line.
Wow, that's amazing. So you mentioned you didn't have coverage. So this is obviously a great development for members of Congress. And obviously you want parity across the board. When you were sharing your egg freezing journey, is that how this conversation came about? Like people were In response to what you were sharing online, they were DMing you?
Yeah, basically,
Wow.
yeah. Or I was going out to events and I would talk to young women who were in the military and they would talk about how that's something that they really wanted for themselves.
I think it's really
You
really
know,
admirable that you opened up about something vulnerable that you were doing for yourself, and that's what sparked this conversation. So kudos to
well,
you.
thank you. And it's so funny. I'm sure you know, right? Like I'm 36 now, but
Hmm.
basically the only thing I talk about with my friends is like who's having a baby, who's trying to have a baby, who
Right.
doesn't want to have a baby,
Right.
and freezing our eggs. And yet I came to Congress and almost none of my colleagues had ever even heard of it.
Wow. Well, if you want me to come to Congress and give a fertility talk,
Okay, I might have you do that.
yes, please take me up on the offer. I want you to explain a little bit more because I'm sure there's a lot of people that are non-military people watching this. And I think it's important for us to understand what is the current state of affairs? Like, what is TRICARE and what are they currently providing and what are the limitations?
Yep. So TRICARE is basically like any other health insurance, except you automatically get it if you're in the military. And what it currently covers for fertility is that it will cover fertility treatments only if you can prove that your infertility is service connected. And we know that that's actually really, really difficult to prove, right? It would have
Hmm.
to be
Hmm.
like a blast that specifically impacted your reproductive
Right.
organs.
Right.
But we know that about 1 in 4 military families report experiencing infertility. And so this is much more widespread and it makes sense, right? We're asking them to go to really dangerous places, do
Hmm.
really dangerous things. I imagine many of the chemicals they're being exposed to are not great for fertility.
Hmm.
They're away from their partners during their prime reproductive years. And so what this bill would do is it would say you don't have to prove that it's service connected. If you are covered under TRICARE as a service member or a spouse, you will have access to this IVF coverage.
That's amazing. As a physician that has conversations almost every day with insurance companies and really trying to advocate for my patients, I can't even imagine how frustrating that conversation is and would be. And I've had patients who, their spouse is in the military, and I see that geographic separation is probably the number one factor. There's so many, not so obvious links between leading a certain type of lifestyle, having a certain type of job, and it just presenting as an added barrier to you being able to build the family that you want. And as you pointed out, a lot of people that are in active duty are actually reproductive age. And because fertility is such a time sensitive issue, this is of utmost importance. And it's honestly so refreshing to hear someone who's not in medicine, a politician, understanding all of these issues, because I think people don't see that direct link all too often.
Yeah, I think that's exactly right. And like, look, this is the third oldest Congress in history, right? Many of my colleagues did not have this treatment when they were going
Hmm.
through their reproductive years. And that's one of the reasons I'm so passionate about having more young people from both sides of the aisle in Congress, because, there's just all these new things that we're dealing with
Hmm.
that honestly, like my colleagues just, they didn't experience it.
Right. And isn't it true that TRICARE as it currently exists when it comes to fertility coverage, you have to be a certain type of person in a certain type of situation. Like this is not inclusive for same-sex couples, for people that are doing this on their own. I mean, tell me
Yeah,
more about
that's
that.
exactly right. So right now under TRICARE, you have to be able to prove infertility. You have to be in a committed married relationship and you have to use your own sperm and your own egg. So not only is it not inclusive for LGBTQ plus couples, it's also not inclusive if you're a single woman, as you said, or if you have some sort of issue where you can't use your own egg or your own sperm. And actually, a couple years ago, we were trying to get that fixed through the National Defense Authorization Act, and it was bipartisan to fix that. We got it through the House in a bipartisan way
Hmm.
and ended up getting it got taken out in the Senate, as most things happen these days in this place. But we're still working on trying to fix that as well, because there are so many reasons why you would not be using your own egg, your own sperm, or
Hmm.
not be a straight couple in a married relationship. Like
Right,
to
right.
me, it's just like a really
No, I mean,
outdated way of thinking about these things.
I mean, it should be inclusive. It shouldn't matter what your sexual orientation or your personal situation is.
But even if you're adhering to their very strict criteria, it seems very unfair because if you have a service related injury, it might be that you can no longer produce sperm, right?
Exactly.
And so for them to not allow that provision under the coverage is really unfair and very limiting. So I completely think that this needs to happen. I don't know how you do your job because honestly, just thinking about this for this conversation, it's infuriating to me. And this is not political. It's like we rely on our military to feel safe and to protect our freedoms and rights. And I don't mean to be preachy, but if I was making that sacrifice, this is the least that I would expect is to be supported in this area, to say, you know what, I'm taking away time from my family in my 20s and my early 30s because this is important for the country. And then to not be supported when you come back or when you finally have the ability to focus on this part of your life is just infuriating and so unfair. So what is the realistic timeline? Like, what do you see happening and when do you think it could happen? And what can we do to make it
Yes.
happen?
So every year we pass a National Defense Authorization Act, which is basically the big bill that has everything around what the military does, how much it can spend, all these things. We
Mhm.
usually do it around June. It looks like it might be closer to September this year, but in that general time frame. And we're hoping that we can get this provision into the National Defense Authorization Act, and it can become law by the end of this year. And then it would probably take a couple of years for TRICARE to actually be able to implement it.
Okay.
But what we're hoping is to be able to get it passed into law this year. So what you can do to help, first of all, if any of you are watching our military families and have dealt with infertility, please share your stories either in the comments or message us directly, because the more stories we have, the more we can advocate for this. But also, if this is something that you care about, making sure your member of Congress knows that is also really, really helpful.
hmm And closer to the time when the bill is up for debate or discussion for the vote, um, I mean, I would love to revamp this conversation and keep sharing and amplifying, doing whatever I can with my platform and encouraging others to do so as well. And I think, whatever angle you look at this from, something that I've heard you talk about a lot is military readiness. And so even if this isn't coming from a what is the right thing to do, what is fair, I mean, what is better for the country? Can you talk a little bit about what you're seeing? Because I think people take it for granted. People assume that there's always going to be people signing up for the military and ready and willing. But what's happening right now? Because I know that there's a drain where people are leaving because they're not getting the support that they need to fulfill their personal goals.
That's such a good point. I hear from so many military families who basically feel like they're given three choices, right? They can shell out thousands of dollars out of pocket
Hmm
to pay for the fertility treatment they need, which in San Diego alone, about 45,000 military families visit the food bank every single month. So this is not necessarily a population that can just shell out these thousands of dollars as needed. They
Yeah.
forego having a family, which, to me is, if we shouldn't be making people choose between serving their country and having a family.
hmm
Or three, and what we see most of these families do is they leave the military to go get a job in the private sector where this will be covered. And we already have a real big problem in our military with recruiting as many people as we need, and then with retaining the very high quality, highly trained people that we have. The last thing we should be doing is making it harder for people to choose to stay in the military, especially folks who we have spent a lot of money training for the
Right.
positions that they're in.
Right. I mean, how do you think this type of advancement? I mean, I just think it's so important for people in the military to know that we are talking about this, that we support them, and that we think this is not fair and it needs to change. But if we are able to affect change, which I believe we will, right? I'm an optimist, and I do think that these conversations are where change can happen. Is there a way for this to kind of then permeate, like, and expand to other groups and create a situation where we're expanding access not just for military families, but for everyone?
Yes. So if it were up to me right now, I would wave a magic wand and everyone would
Yeah.
have access to IVF coverage, and the
Yeah.
full range of fertility treatment and reproductive health care that they need. part of why we chose to use this population first is one, because members of Congress will already be getting this coverage under the DC Health Exchange laws. And so we thought it would make sense. We can get a bipartisan consensus on this, which we've been able to do in the past, but also because what we often see is that when TRICARE starts covering something, then we sometimes often see private insurance then start to cover it as well, because
Right.
they see that it's a benefit that people want and use. And so this is kind of one way to try and get it so that every insurance covers it.
So it's basically like get your foot in the door, normalize this idea that this is something that everyone should have a right and have access to. And then, with each pocket of the population, like we basically, target what we can to try to improve access and normalize this idea. But I really do think that this is the first step. And I think that this is a vulnerable group that traditionally hasn't always had access to, the best care and all the things that we think they deserve for the sacrifices that they're making. And we really need to make this right.
Yeah, absolutely. Absolutely. And like, it's also like the thing I try and also remind my colleagues is like a lot of these military families are living all across the country. They don't control where they
Right.
live, right? They don't control the laws of the states that they live in.
Mhm.
And they aren't necessarily only one party. A lot of military families span the gamut of partisanship, right? Like this is not a partisan issue.
Right.
This really should just be something that we make sure everyone has access to.
Someone just asked a question. I was wondering if you could field it. What would be the option for people on TRICARE Select who pay copays? I mean, this might be a very nuanced
Yeah.
question. I don't know.
That is a good question. It would be up to how the health agency DHA decides to implement it, but we'll get your contact information and I'll have my legislative staffer follow up and give you sort of more specifics on
Yeah,
that.
I think if anyone has questions like that, I would DM Rep Jacobs because she can definitely connect you to the right people. Um, I think that this is such an important conversation. Are there any questions that you have for me in conversation? I've been kind of peppering you with questions this whole time because I'm just
Yes.
so interested and so passionate about this issue.
Well, yeah, I mean, I love all of the education you do around this because, like I said, when I froze my eggs, it was so much of just explaining to people what that even meant, why I would do it.
Right.
And I really, now that I've turned 36, like, I do feel like just so much more agency in this really, like, the biggest decision you make in your
Yeah.
life. Um, what are some of the most common misconceptions you hear about egg freezing or IVF, or like, what are some things that you wish more people understood?
Well, I'll first focus on the issue of military
Yeah.
families because that's kind of what our conversation is about today. And then trust me, I have an endless list. We wouldn't have time, but I'll try to pick a few. When it comes to military families, I think because the average age tends to be younger, there is this bias towards thinking like, this isn't a demographic that likely will need IVF, right? Because it's so traditionally linked in people's minds to trying to have kids in your late 30s and 40s and beyond. And that's not true. We know that there's so many different types of fertility issues that can arise even in your 20s and early 30s, whether it be, having just a mechanical blockage, the fallopian tubes are blocked and you need IVF to bypass the blockage. And that could be because of service-related injury. That could be because of just other things that can come up in life, like infections and other sources of inflammation, like endometriosis, which is a really common disorder. It affects 10% of the population. That's probably a huge underestimation, given that the average age or the average duration to get a diagnosis of endometriosis is like 8 to 10 years. So that's another huge category of types of medical problems or gynecologic issues that can cause infertility. Um, I would say PCOS, where someone's not ovulating regularly, is a very common thing that we see as a cause of infertility in younger women. And, the list goes on. So I have patients of all ages. Not all of my patients are in their 40s. And I actually have had patients whose spouse or they themselves have been in the military. I have people from out of state that have traveled to me because they're kind of traveling around all over the place anyway. And they're like, New York's a bit of a hub. Let me go there for treatment. And I've navigated these really frustrating situations where it's like maybe at the outset it seems like there is coverage, but then when you read the fine print, you're like, oh, well, I don't, fill this criteria that my infertility is related to a service injury. And then you're like, okay, you go from thinking you have coverage to, being very let down and feeling very stressed about how you're going to cover something like this financially. I think another major misconception is that things like egg freezing are only necessary if, you're of a certain age or if you're in a certain situation. And nowadays, I'm seeing that kind of fall to the wayside. Before, it was like 10 years ago when people were thinking about being proactive about their fertility and their future and freezing their eggs. um Usually it was coming from a place of like, I just got out of, a bad relationship and we broke up, and now, I'm over 35 and this is why I'm doing it. And it kind of felt like a last resort that they had to do this, not that they wanted to do this. And now I'm seeing people come in with or without a partner and saying, I'm doing this for me. Yes, I'm 28, I'm 32, I'm 36, but they're not coming at it from an angle of feeling defeated or that this is not where they wanted to be in life. It's like, no, I'm actually in a great place in life right now, but I want to do this for my future because I don't know what's going to happen with this relationship or my job. And I want to have, some sort of potential head start, because a common misconception is that this is a backup plan or an insurance policy. And maybe it sounds like semantics to some, but I think our words matter. And I call it a head start because of something I talk about often, which is, human reproduction is inefficient. And when we have frozen eggs, we can give ourselves a head start for the process of IVF if and should we ever need IVF, which might be due to female factor, could be due to male factor, right? Or a combination of the two. Whatever the issue is, when you start out with your frozen eggs, having more of a supply of higher quality eggs that are going to have a higher conversion rate from eggs to embryos, that is going to give you a head start that makes it more likely that your IVF journey could be more successful. But certainly not every egg equals a baby. And that has been also politicized as an issue, but we won't get into that. So it's important to realize that not every egg is capable. And so you can't say egg freezing is a guarantee. You can't call it an insurance policy because in most cases, the way insurance is supposed to work is your house burns down, you get the insurance money to have a new house, right? Or however it works. In this case, it's not a guarantee, but provided you've been counseled adequately and for your age and what we think your egg quality may be, because there's no direct way to test that. If we start off with enough eggs, then we've baked into the equation that we know how many might thaw on average, how many might fertilize, how many might grow into embryos, and how many of those embryos are probably going to be normal versus abnormal based on the age of your eggs. And so it's about having this counseling conversation before, not after the fact, when you're actually coming back to use your eggs, so that people can really understand the best that we know based on the stats and your age and things like that. This is where we think you stand now that you've done this process. And you have the option, if you need to do a second round if you need more to feel more confident. Now, I know all of this sounds great in theory, and the number one comment or question that I get is about the cost because not everyone has coverage. I think it's amazing to hear that Congress is now has this option for people. But I'm always curious because I think another common misconception, and now I'm just like rambling, but
Yeah.
I told you I could keep going
No,
about this
this is great.
forever. And this is relevant to today's conversation, right? When you do get coverage for IVF, it's so great. I do wish though that we were thinking more preventative, and this is like a healthcare problem across the board, instead of thinking about the band-aid and the solution to work around a problem or a barrier, trying to prevent those problems in the first place or get ahead of them. And so speaking about military families, like, wouldn't it be amazing if a woman is being deployed and she's in her early 30s to be able to say, hey, your country's got your back. We're going to let you, we are going to facilitate you freezing your eggs.
Yeah.
Go to this clinic, freeze your eggs, and then you can go away and focus on protecting, our country and doing the good work that you're doing. But knowing that you've already gotten ahead of this, maybe you won't need to use those eggs, but that would be fantastic. So I know it's baby steps, but those are just like a few of the things that I think stand in our way, because when people don't understand what the issues are and how all of this works, then we're further from a solution. And that's why I think it's amazing when lawmakers and doctors like myself are having these conversations, because everyone gets smarter who's listening to the conversation, and we can be more aware of the issues, and that therefore we can put our heads together and come up with solutions. Because I don't know how to pass a bill, you know how to do that, but I can give you the information and the tools that ensures that the bill and what's being proposed makes sense and it's actually good for patients.
Yeah, absolutely. And that is also my dream. That's kind of how this whole conversation even started, because a young woman came up to me and was like, I'm about to deploy and I really want to freeze my eggs, but I can't get TRICARE to cover it. And so
Yeah.
I couldn't agree with you more. Like, just the idea that it gives people more agency, that you can focus on your career and you can make timing decisions. Obviously, nothing is 100%, as my fertility
Mhm.
doctor reminds me every time I call and check in. But it just gives you a little bit of a feeling that, like, you have more control over
You've
your life.
done everything that you can do.
Yeah.
Right. And you've informed yourself as much as you can be informed, and you've taken the steps that are possible to take. And that is hugely empowering. And it really, I think one of the hardest parts about my job, there's a lot of hard parts, there's a lot of great parts, but I think one of the hardest aspects is that while we've seen a major rise in this country in coverage, and it depends on where you are, right? Like I'm in New York City, it's a competitive job market. So the biggest expansion in access to care when it comes to fertility preservation and even infertility treatment has been in the private sector through jobs, employers providing this benefit, because it's kind of like, you're dangling the incentive, and it's one way to expand the pie and provide more benefits to attract great talent. And however we get there, I'm just happy when people have coverage, but that's really where we've seen most of the expansion. And it's been incredible to watch. Like in my clinic, I'm in one of the largest clinics in the country. Over the past 10 years, we actually just published our data, and it showed that 10 years ago, 0% of fertility preservation was covered, whether it was medically indicated for someone facing cancer, and needing chemotherapy that could irreversibly cause infertility, or whether it was someone who was just trying to get ahead of their biological clock, 0%. And now we're at a place over 10 years later that almost 50%, I think we're probably approaching over 50% at this point, of the cycles involved in fertility preservation at our clinic have insurance coverage. And, that's not to say that's representative of what's happening in the general population, but it is a sign of major progress. And as a result of that expanded coverage, we're seeing the average age of the patient who's undergoing these preventative treatments is dropping steadily from where it was like late 30s 10 years ago to now closer to mid 30s, and it keeps decreasing. And that in turn allows it to be more successful. It allows it to be more successful doing fewer rounds, because people, generally speaking, as they're younger, have better quality eggs and there's more of them. So I'm all about being proactive and getting ahead of problems before they start. And I don't necessarily think everyone has to freeze their eggs, but it is heartbreaking to me as a physician when people want to. People DM me all the time saying, This is something I really want to do, but I can't afford it yet." And that's really unfair. It's really something that everyone should have access to.
Yeah, I couldn't agree more. And we're going to keep working to make sure that everyone has access to the full range of reproductive health care that they need, which to me means deciding not to have a baby, but also deciding when, if, and how to have a baby.
Yes, yes, here, here. Well, thank you so much. Is there anything else you wanted to tell us, or any last thoughts before we wrap up? And let's definitely do this again, especially as we approach the summer, because I really want to ramp up the effort and do whatever I can to make sure this gets passed.
Yeah, let's definitely do this again. And I guess just a reminder to anyone watching, I know we all shouldn't have to bear our personal reproductive stories to get change, but unfortunately, the world we live in, the most impactful thing we can be doing is sharing those real human stories and breaking down the stigmas and showing people that this is a whole range of families who need this kind of treatment and why it should be more covered. So please do share your story. It really is really helpful as we're working to get my colleagues on board with this.
I couldn't agree more. Thank you so much for making the time. I know you're busy, you're in DC making moves, but I appreciate you sharing everything that you did today with my audience. And I hope we can do this again soon. And this is something that we should all be passionate about for a variety of reasons. And I really appreciate all the education you provided today on it.
Absolutely. And thank you for everything you're doing. I've been watching all of your stuff as I have questions myself about my fertility. So your educational products are very helpful.
Well, DM me anytime and we'll definitely stay in touch. It's so lovely to meet you.
Sounds good. Likewise.
All right. Have a
All
great
right.
night. Bye.
Bye.